Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about what is embryo pooling in IVF. Now, patients who have a very low AMH indicate a very low ovarian reserve, and those whose antral follicular count is low are advised IVF cycles. Many a times we see that these patients end up having only 1 or 2 follicles and we get only 1 or 2 eggs of which we make a child. Now, if we get 1 or 2 M2 eggs on the day of ovum pickup, which means we might land up only with 1 or sometimes even none embryos. Now, in first cycle, when suppose we get one good embryo, we freeze that embryo. In the subsequent cycle, as her ovarian reserve is very less, she is ideally advised a dual stimulation or a duo-stim protocol, or in the subsequent cycle, we advise another round of IVF injection so that we can get 1 or 2 more oocytes in a patient who is having already low ovarian reserve, so that if she forms 1 or 2 more embryos, her chances for successful IVF implantation would increase by 20 to 30%. So generally in these kind of patients with a very low ovarian reserve, we prefer to put minimum of 2 good blastocyst embryos. Now, to make 2 good blastocyst embryos, the patient might require 2 or sometimes even 3 IVF stimulation cycles, as her egg reserve is very low. So in these patients, we advise Accuvit or embryo pooling. What is done is, we make embryos each cycle, we freeze them in liquid nitrogen with vitrification technology, we pool all the embryos of the same patient, and then when we finally do an embryo transfer, we thaw all these embryos which are made at separate months together, and then we put all the embryos which are made at different times together in the embryo transfer cycle. So this embryo pooling is an excellent technology for patients who want to prevent donor cycles, and if you have very low AMH and antral follicular count, though it definitely requires a lot of patience, as you have to do almost 2 to 3 ovarian stimulation cycles to get that much number of good quality embryos. Thank you.